In honoring Black History Month, tonight we remember Dr. James Alexander Franklin, described as a scholar, a humanitarian, and someone who loved the Lord.
We show you how the legacy of a man born back in 1886 is making people healthy even today, and the amazing story of what brought him to Mobile in the early 1900s.
Right, deep breath in for me.
Sherry Jones finds relief at Franklin Primary Health Center. She started coming here 8 years ago for migraines.
The doctors here, they listen, and understand what you're going through.
This facility is built much on the philosophies of Dr. James Alexander Franklin, born in Chattanooga, Tennessee, treating everyone regardless of income. The only African American in his class, Franklin graduated second from medical school at the University of Michigan. After graduation, he practiced medicine in Evergreen, Alabama, circa 1916.
We had a pandemic. It was the Spanish flu. And this white person came to his house and said, "My wife is dying, please come help me." Well, Dr. Franklin has been about medical care all his life. It wasn't about color, it was about health.
But trouble came months later when the wife revealed to a friend Dr. Franklin saved her life.
She said, "Dr. Franklin?" She said, "Yeah, you know, the colored doctor," because blacks were colored back then. She said, "Oh, I'm so happy," and left. Well, by the time the story got from A, B, C to D, all D knew was that a black man had touched a white lady. And there was a mob coming to lynch him. And the husband tried to stop the mob, but he couldn't.
As the story goes, the husband sold his only horse to give Dr. Franklin, his wife, and then 2 children the money to get on a train and go as far south as they could. They ended up here in Plateau, Africatown, where the doctor lived and made house calls with a blind mule and a wagon.
Of course, we referred to Dr. Franklin as Big Daddy. And this was my mother, Evelyn.
Eric Finley's mother, Evelyn, is one of the doctor's 2 children who made that train trip. Finley's grandfather, though penniless, would have a profound impact on Africatown.
I mean, he did it all. He was a person who saw adults, that meant women and children. He did pediatrics care, he saw children, and then he also delivered babies. He delivered a lot of those babies at home. He did a lot of home care. He would travel sometimes 20 and 30 miles to go see his patients.
That's why Dr. Franklin was so essential and important, because here was one of their own who welcomed them and was highly educated and a good doctor, and he never turned them away.
Dr. Franklin moved his growing practice to what was then Davis Avenue, now MLK, and his growing family into this home on Ann Street in Mobile. Inside the historic Franklin House and Gallery are photographs of his 10 children and black celebrities who stayed here when they were unwelcome at local hotels. Also on display, a 1954 article by Ebony magazine highlighting what it called the South's richest Negro doctor, telling how Franklin turned poverty to wealth with decades of hard work. He died in 1972, leaving a void in the community, one that motivated a nun and science teacher at Most Pure Heart of Mary to make a career change in her mid-30s.
Mrs. Finley was the daughter of Dr. Franklin, and she told me that if I ever became a doctor, that they would be happy if I would use their clinic in the memory of their father. So that deeply inspired me. That deeply inspired me to apply for medical school.
She goes to med school. She becomes a physician. And she comes back and starts to seeing the patients in Dr. Franklin's office. She convinced her entire senior class to come over and rotate through that office, along with some of the other local doctors.
Before she graduated from medical school at the University of South Alabama, Sister Marilyn Aiello founded Franklin's Primary Health Center. Students, nurses, and doctors volunteered to treat patients, carrying on a legacy going strong today. One that heals and delivers a sense of pride.
It's awesome. It's amazing to know that, you know, you have doctors and especially of our race to do what they've done, you know, for not just us, but for other people as well. So it's really great.
Franklin Primary Health Center is a nonprofit that operates on a sliding scale based on income. They don't turn anyone away. It has 23 locations in 6 counties: Mobile, Baldwin, Escambia, Monroe, Conecuh, and Choctaw, with plans of starting a family medicine residency program in the near future.